So much for having me this evening and joining me. So, yes, my name's Megan. I'm a public affairs specialist for Social Security, and I'm actually based out of Peru, Illinois. And I was just telling Sadia, if you're not familiar with Peru, a lot of people are familiar with Starved Rock State Park. So, I'm about 10 minutes from there. And I'm the public affairs specialist for your area and a large portion of northern and north central Illinois. So tonight, like I said, we're going to go through an overview of our programs, and then I'll be happy to answer as many questions as possible. Just make sure you're not putting anything like a social security number or other sensitive information in the Q&A or chat box. Just to give you a background of things to start, some people are already familiar with this information, but others just kind of aren't quite aware of how all of the funding comes from Social Security. So when you are paying your Social Security tax or FICA tax, comes out of your paychecks, that is going toward funding our Social Security trust funds. So this year, the FICA tax total is 15.3% of gross wages, and 6.2% for Social Security and 1.45% of what you pay in for Medicare, because you and your employer each pay 7.65%. So that's funding Social Security's retirement, disability, and survivor, as well as Medicare insurance. Now, overall, last year, 182 million workers were paying Social Security, which is about 94% of workers paying into Social Security. Today's presentation is going to focus on people who do pay into Social Security. Now, in the state of Illinois, we do have some categories of individuals who do not pay into Social Security with their work. The largest portion of those would be public school teachers paying into teachers' retirement system, also City of Chicago employees. So there are some exceptions. And while I'm not going to cover that tonight, just know that we do have a lot of information on all of the things we're going to talk about tonight, including information for individuals who do not pay into Social Security on our ssa.gov website. To start off with, we're going to talk briefly about our disability program. So we have two different programs we pay benefits off of based on a disability. The first one we're going to talk about is Social Security disability insurance. And something to know about this is you can actually file and receive Social Security disability as long as you're found disabled prior to your full retirement age, as long as your month of entitlement for disability is prior to that point. So maybe you are 62 and you're looking at retirement benefits, but you're not actually looking at retirement because you're really excited to go out and stop work, but it's actually because you have a medical condition that's preventing you from continuing to work. That's a situation where you would think about filing for disability. And actually between 62 and full retirement age, you can file for both disability and retirement at the same time. Social Security disability, this is when you've worked and paid those FICA taxes, worked and paid into the program, and you have a disabling condition. So what we mean by disability, and this is our definition with the Social Security Administration, other agencies have a different definition. What we're looking at is ability to perform substantial work, and that's a dollar figure every year. So ability to perform that substantial work and have a medical condition that's expecting to prevent you from performing that substantial work for at least 12 months. So it's a long-term disability program, or having something like a terminal illness. So it's expecting to result in death. And like I said, younger than full retirement age, under that substantial gainful activity, and having enough recent and overall work paid into the system to qualify for the Social Security disability. And then we have another disability program. It's completely separate than Social Security disability, called Supplemental Security Income. And this is a needs-based program. So for adults, it's the same medical definition of a disability as the Social Security disability, but for this, we're looking at income and resources. Now, supplemental security income is also available to children who have disabilities. Of course, with children, we're not looking at ability to work, but we're looking at their ability to function relative to other children their age. And then this program is also available to individuals 65 years of age or older. And when you're of 65 or older, you do not need to have a disability, a medical decision. It's just looking at income and resources. And for that, that's called our AGED program. So again, looking at the kind of breakdown differences between Social Security disability and supplemental security income. Social Security disability, you're paying into that trust fund, and those payments are coming back out of the Social Security trust fund. And your monthly benefit is going to be based on your earnings history. For supplemental security income, or what we're going to call SSI for short, that's a separate general trust fund that those payments are coming from. With Social Security disability, there is no income or resource limitations. So you can have $1 million in your bank account, you can have many vehicles, all of those things, and still qualify for Social Security disability as long as you meet the medical criteria. But with SSI, you have to have very limited income and resources. And then Social Security is for the worker who has paid into the system if they're found disabled, and then possibly other people on their record. And I'll talk about that in the retirement section. And then SSI is for children or adults with disabling conditions with those limited income and resources. Now, of course, what people often think about when they think about Social Security is retirement. So for retirement, and I will say in this part, this is the same as far as the amount of money you need to make to earn credits for both disability and retirement. It's just the requirements of how many credits you need are different with disability for younger people. So when you're looking to qualify for retirement, you're working and earning credits by paying those FICA taxes that are coming off your Social Security check. In order to get a retirement benefit, you just need 40 credits total. It does not matter when in your lifetime you've earned those 40 credits, as long as you have the 40 total. Now, many of us are going to be able to get that within 10 years of work because you can earn up to 4 credits a year. So this year, to get 1 credit, you need to make $1,640 or $1,640, 4 credits for $6,560. So back when we used to send out those paper statements every year, which we're going to talk about how you get those statements now at the end. But I remember when we used to send those paper statements out, and I think when I was like 25 or 26 years old, I already had those 40 credits because of just working part-time jobs starting at a younger age in my early teens and going forward. So it doesn't take a lot of money to get your basic 40 credits, and not a lot of time, just that 10 years minimum to get your 40 credits to get a retirement benefit. But of course, most of us are paying more than that minimum that we need in to get that retirement, qualification. And everything that you're paying in up into the max that we tax every year. So every year there's a cutoff of where we stop taxing for the Social Security part of the taxes. Medicare continues, but Social Security has a max. Let's see, for 2023, that max is $160,200. So up until then, you're paying in those FICA taxes every year. And when you go to retire, what we're going to do to calculate your benefit is we're going to find the monthly, or we're first going to adjust them for inflation. So whatever you earned in 1980, you'll be surprised maybe to see what it is in today's dollars. So we're going to take your wages, we're going to adjust them for wage levels over time. Then we're going to find the monthly average of your 35 highest years of earnings. From that, we're going to get an average index monthly earnings. And when I say we, I mean the computer. So it's not me sitting with a calculator doing all this work. The computer system is going to figure this out for us. And with your average index monthly earnings, we're going to apply a formula to that. So if you are somebody who's really into, math, what you can do is go onto our website and you can look at this publication called How Your Retirement Benefits Are Figured, and it'll tell you how to manually calculate all that. But again, toward the end, I'm going to show you where you can just get that estimate without going through all the math. That's not my favorite thing to do, but it is available if you're into that sort of thing. So One of the questions we get a lot from people is, well, when should I start taking my benefit? When should I file? And we can't tell you at Social Security when to start your Social Security benefit because the answer is different for everyone. There are so many different factors that go into that decision. The one thing that we can tell you is that it's going to go up every single month you wait. You're going to have an increase just by waiting between 62, which is your early retirement age, on up until your full retirement age. Now, this chart, this person's full retirement age is 66. I'm going to show you in a moment that most of us are going to have a little bit higher of a full retirement age than 66. But just for this example, their full retirement age is 66. So if they're at 750 at 62, every single month they wait past 62, going to go up. Full retirement age is 1,000. And then between full retirement age and age 70, you earn delayed retirement credits. Those average about 8% per year. So in this example, if the person waits all the way until 70 to draw a benefit, they're going to get $13.20 a month. So of course, from a financial standpoint, somebody will say, well, obviously I should wait till 70 to draw a benefit. But the answer, like I said, is going to be different for everyone because there's a lot of things to think about. Some people factor in longevity for their family, kind of what usually happens or what, their parents have had for longevity and say, you know what? Yeah, people in my family always live till 100. I want to try to wait as long as possible and max that out. Whereas someone else might say, people in my family don't always, live to a very old age. So I'm going to go ahead and start my benefits when I can and enjoy them. And so every person's situation is going to be different. Someone else might say, I'm going to work till 65 when I can get my Medicare. So each person needs to consider all those factors, all your other retirement funds, savings, investments when making that decision. Now, here's where you can find your full retirement age. So I mentioned that it has been increasing from age 66. So on this chart, based on your year of birth, you can find your full retirement age. So for myself, my full retirement age is 67. So if I go ahead and take it at 62, I'm going to have a 30% decrease. So just at that time, I'll have to be thinking about what my situation is, if I'm ready to go ahead and start my checks, or if I want to wait and let them grow. One of the big factors in deciding that, though, is if you're still working, because when you are under 62, when you're under your full retirement age, you do have an earnings limit. So for this year in 2023, so if you happen to be watching this video later on, everything I'm talking about today as far as dollar figures is for 2023. This year in 2023, then earnings limit is $21,240. And after that, we hold $1 for every 2 that you go over that limit. So let's kind of go through an example to see how this works in real life. Let's say that you had contacted us back in January. You're 62 and you're still working, and you told us, I want to start my checks with January. And this year, I think I'm going to make $36,000. So what we would do is subtract the $21,240. And then because we hold $1 for every 2, we divide the remainder in 2. When I do that, I see that you're $7,380 over the earnings limit. Now, to make it easy, let's say your monthly benefit is $1,000 a month from Social Security. We can't hold a partial check. So what we're actually going to do is hold 8 months of benefits because you're over the earnings limit by that $7,380. So we're going to hold $8,000 in checks before we pay you anything. So even though you filed with January, we're holding January through August. You would first be due a check for September. All Social Security checks run a month behind. So September's check is going to be received in October. So even though you took your reduced rate of January 2023, you're not going to see any money from us until October. So maybe when we talked that all out with you in January, you said, I'm going to wait until I stop work or reduce my work further to draw any benefits. Now, if you decided to go ahead and draw your benefits, that's fine. And what would have happened is at full retirement age, when you hit that full retirement age, we'll recalculate your benefit to give you credit for the fact you took it, that you had those 8 months in suspense. So it'll almost be like we're recalculating it that you took it that much later. And I know this can be kind of confusing to understand sometimes. So again, it's something we do have more information about and have a calculator for on our socialsecurity.gov website. And then you can see the year you turn your full retirement age, that year between the January and the month you turn your full retirement age, you have quite a higher earnings limit. So if you're making $36,000, but you're hitting your full retirement age this year, you could get all of your checks because the earnings limit is $56,520, and we hold $1 for every 3. Then the first day of the month in which you hit your full retirement age, you can work and make as much as you want. You can make $1 million if someone's paying you that and still receive all your Social Security checks. Now, there is another situation we consider. So this is when somebody's working all year. We call it the yearly test. We also have a monthly test that we can use. The monthly test is just the yearly divided by 12. And what this is for people who are not working all calendar year. So maybe you are working right now and you've been working since January and you say, you know what, the weather's starting to finally get nice here in Illinois. I think I'm going to retire. I'm going to stop working in May so then I can go ahead, retire, and enjoy the summer. And so January through May, maybe you made $80,000. So you're way over that earnings limit. It does not matter how much you made between January and May. If you select June for your month of entitlement, June paid in July, it does not matter what you made up until then, as long as you stay under the monthly limit, which is just the yearly limit divided by 12. So the monthly limit this year is $1,770 a month. So as long as with June and every single month for the rest of the year, you stay under that $1,770, you can start your checks with that June month, even though you went way over that limit. So that's just a test that allows people to go ahead and start their checks mid-year at some point, even if they've been working significantly up until then. So in addition to benefits, we can pay a retiree or an individual on disability. There are oftentimes benefits eligible to family members. So the first category we're talking about here is children. Now, the rules for children receiving a benefit off a parent are the same, whether the parent's on disability, retirement, or they've had a parent pass away. A child must be unmarried, younger than 18, or 18 to 19, and still a full-time student in high school. So we do not pay anything for college or anything past 19. So a lot of times somebody might turn 18 while they're finishing up their senior year, and the school can just fill out a form and we continue to pay throughout that school year. But it does stop at, based on a high school attendance, at 19. But then we have one final category there: 18 or older and disabled prior to age 22. So you might have an adult child who's maybe 40 years old by the time you go to file for your retirement benefit. If they're not married and they have had a disability since before age 22, have not worked substantially on their own earnings, they can potentially get a benefit off your record. Now, all these categories that we're talking about as far as children, and we're going to talk about spouses and former spouses, you don't have to remember this all right now, because when you file for retirement, hopefully you file online, or whether you file via phone appointment or appointment with your office, we are going to ask you all these questions. So we're going to ask about children. We're going to ask about current and previous marriages. So you don't have to remember to tell us about your children. We're going to ask you as part of the application process. Now, before we get into spouses benefits, just something to note. There was a policy change for people born January 2nd of 54 or later. So if you have some friends or relatives who were born prior to that date, they might be telling you about different retirement strategies that they used that you're not eligible for. So what this is called deemed filing. So deemed filing says that basically if you have your own 40 credit earnings record, you have to file for your own benefit before you can file for anything else off anyone else's record. So filing for one thing deems you to file for any other benefits you are eligible for. So retirement and spouses, or spouses and retirement, vice versa, or divorced spouses. And this policy applies to benefits off someone who is living. We're going to talk about survivor's benefits. It does not apply to that, but it applies to benefits as a spouse or divorced spouse. So when we're talking about this first set of benefits, spousal benefits, we're going to assume deemed filing applies. So if you're filing, we're going to look for any benefit your spouse might be eligible for off your record, or vice versa, anything you might be eligible for a spouse. So we're going to say, are you currently working? Are you currently married? And if you answer yes, what we're going to do is you have your own 40 credits. We're going to figure out your full retirement age rate benefit. So we're going to look at 100% of your own benefit. Then we're only going to be looking at a spousal benefit if your spouse is also filing or already collecting a benefit. You can't get anything off of them until they are filing or collecting. This is someone you're currently married to. If 100% of your own benefit is more than 50% of your spouse's full benefit, and this is full retirement age rate, no matter how old either of you are. If 100% is more than 50% of your spouse's, there's no spousal benefit payable. Same applies vice versa for your spouse filing off you. But if it is less, then what we're going to do is we're going to pay you what we can off your own, and we're going to reduce it if you are under your full retirement age. Then we're going to pay 50% off of, we're going to pay the difference between 100% of your own and 50% of your spouse's off their record. So you're not getting both 100% of your own and 50% of your spouse's, you're getting the total. We're also going to reduce any spousal benefit if you're under your full retirement age. Anytime we pay a benefit to a spouse, it does not reduce the payment of the worker it's being paid off of. Spouses need to be 62 to collect a benefit unless they're caring for the worker's child who's younger than 16 or disabled. Now, also, spouses, children, survivors all have that same earnings limit that we just talked about. Now, divorced spouses, there are some differences. And this, again, is off somebody who's living. So we're going to look at assuming deemed filing, we're going to look at the person's own benefit first before we look at anything off a former spouse. So the next question we're going to ask in the application is, have you had any previous marriages lasting longer than 10 years? Because that is the age requirement for benefits off a divorced spouse who's living. You have to be unmarried to file off a divorced spouse and at least age 62 years of age or older. Now, here's a big difference between benefits for a current spouse and benefits for a divorced spouse. To draw off your divorced spouse, your ex-spouse, they do not have to be receiving their benefit yet. They just have to be eligible to receive their benefit, meaning they are at least age 62 or older, and they have their 40 credits, or they're receiving a disability benefit. Now, anytime we pay a divorced spouse benefit, it does not reduce the payment of the worker. It also does not reduce the payment of a spouse or children on the record. It's an independent benefit. And then our final category of monthly benefits we're going to talk about is survivor's benefits. Again, rules for the children are the same: under 18, still in high school, disabled before age 22. But there, again, are differences with surviving spouse or surviving divorced spouse benefits. So one thing is you can get survivor's benefits as early as age 60 or as early as age 50 if disabled. Again, any age of caring for a child under 16 or disabled. Another thing, you can remarry after age 60 and it will not affect the survivor's benefits. So if you're past 60 and you marry someone else and you're on a survivor's benefit or thinking about drawing that survivor's benefit, you can still draw the survivor's benefit even though you're currently remarried. Another thing is the percentage. So you're going to get up to 100% of a deceased worker's benefit. At age 60, it's 71.5%, and it goes up every month you wait between age 60 and full retirement age. Now, one thing is you do not want to wait past full retirement age to claim a survivor's benefit, because you do not earn delayed retirement credits on it. So again, a little bit of a breakdown. As early as 62 off someone who's living, 60 or 50 if disabled off someone who's passed away. You're getting 50% or less off someone who's living, 71.5% to 100% off someone who's passed away. Now, the other thing is these benefits are an exception to deemed filing. So you can take a survivor's benefit and let your own grow until up to 70, or you can take your own benefit and let the survivor's benefit grow till full retirement age. There are some different strategies here. And so that's just what I was kind of talking about. With the exception, you can go ahead and use those different strategies that you cannot use under deemed filing with a benefit off someone who's living. Another thing to note is that a lot of people don't qualify for a regular spouse's benefit because their own is more than the 50% off the spouse's. But it's important to contact us if a spouse or former spouse passes away, so we can check to see if you're then eligible for the survivor's benefits, because it is that higher percentage you're now eligible for. Some other survivor's benefits we have our lump sum death payment. It's $255. You might have seen those life insurance companies that like to kind of make fun of it because it is a small amount. It does not go very far in today's funeral expenses, unfortunately, but it is payable. It's only payable to a surviving spouse, so not a divorced spouse or a minor child or disabled child on the record. It's not payable otherwise to an adult child or an estate. And then parents' benefits, I'm going to be very honest, this is not very common, but it is something we have available. This is when a child was providing at least half financial support to their parent, age 62 years of age or older, and the child passes away, the parent could potentially get a benefit off that record. So now we're going to switch gears a little bit to talk about Medicare. And just to preface this, at Social Security, the only thing we handle with Medicare is enrollment in Part A and Part B. And then we have something called extra help. That's financial assistance related to the prescription drug plan. But we do not do enrollment in prescription drugs or Medicare Advantage or supplements. We don't handle questions about billing, coverage, anything like that. So just A and B, we're going to get you to for Medicare. Everything else, you can direct your questions to medicare.gov or a SHIP counselor who can help you wade through all the other things. I do want to cover some basics about Medicare, though. So, original Medicare, traditional Medicare that we started with, Part A, hospital insurance. That is when you are inpatient overnight. So it does not include ER, but it's actually admitted into the hospital. There is no monthly premium for that as long as you have 40 quarters from your own or a spouse's record. Then Part B, your medical insurance. The base premium this year for that is $164.90 a month. Some people do pay more. Now, along with that original Medicare, we added prescription drugs. That came along, about 20 years ago or so. So that's called Part D. And you can have that with just the original A and B. You can also add supplements. So anything above the letter D is a supplement or a Medigap policy. Then increasingly popular are Medicare Advantage plans, also known as Part C. So with a Medicare Advantage plan, Social Security still handles the enrollment of Part A and B, but everything else, all the billing and everything like that goes through the private Part C plan. So you're not even contacting Medicare about billing and things like that. You're actually contacting your plan. Some people like Medicare Advantage plans because they usually include your prescription drug plan along with it, so you don't have to figure that out separately. They also can include things like vision, hearing, dental, things like that, which can lead to lower out-of-pocket costs. As far as when you can get onto Medicare, the first big time that everyone's thinking about it is age 65, but there is also Medicare eligibility for individuals on Social Security disability, so not SSI, but Social Security disability after 24 months. And there's specific policies for individuals with ALS and kidney failure. Now, as far as age 65 goes, your first opportunity to get into Medicare is your initial enrollment period, which is 3 months before your birthday, the month of, and the 3 months after your 65th birthday. If you are already receiving a monthly Social Security check, you will automatically get enrolled in A and B. Your card comes in the mail about 4 months ahead of time, so you just have to be careful opening all your mail because it comes in a relatively plain envelope with a little like Medicare bird in the corner, CMS bird. So you just want to make sure you're not throwing it away because it seems like everyone in the world has figured out you're turning 65 and they're all sending you a bunch of junk mail. So that's something to be on the lookout. But if you're not already receiving Social Security, nothing magical happens to put you into Medicare. So if you need it at age 65 and you need it right away at 65, you want to take care of it in the 3 months before you turn 65. If you wait till the month of your birthday or the 3 months after, it won't begin until the month after the month you enroll. So that's your first opportunity. Now, you're going to get letters that talk about penalties and things like that, and that may or may not be applicable to you. So if you do not have any other insurance that's based on active group health plan through current employment, you probably need to get into Medicare. So let's say you're under a retiree plan, or you're through the marketplace, or you're under the VA coverage, all sorts of things like that. Those are all situations we recommend you getting enrolled into Medicare at age 65. But if you are still working and covered under a group health plan based on that employment, or your spouse is working current work and covering you under their group health plan, you generally do not need to take the Medicare at age 65. If we've automatically enrolled you in the Medicare because you're receiving a check, you will have to keep the Part A, but you can refuse the Part B, and the Part A is free. The reason you can wait is because you have that group health plan based on current employment, which allows you a special enrollment period. So we just recommend, if that is your situation, when you're coming up on 65, you just check in with you or your spouse's employer to verify that they don't need you to do anything. And then when you're ready for the Medicare, because the employment's ending, then you can enroll at that time without penalty. But if you don't enroll at age 65 and your first opportunity and you're not covered under one of those group health plans, and then later on you figure out you do need the Medicare, that's when you have to wait for a general enrollment period. So this would be if you just kind of said at 65, you know what, I never get sick and I don't want to pay the money for that Medicare, so I'm just going to not enroll yet. If that's your situation, then you would have to wait for general enrollment period, which is January through March of every year. And then as of this year, the coverage begins a month after the month you enroll in the general enrollment period. They used to make you wait till July, but now it's just a month after. So we just got out of that general enrollment period. So if somebody's just figuring this out right now that they need Medicare and they're past their first opportunity, they don't have that special enrollment period, they have to wait all the way till next January to have it start January, enroll February, coverage start. So that's a long time. The other thing is there's a 10% penalty onto the monthly premium for every year someone did not take the coverage when they're in that general enrollment period situation. So it's just wise to do all your double checking and get your planning done within a few months coming up on 65 to figure out if you do or do not need Medicare. So this is what I was talking about as far as the enrollment kind of changing It used to be 2 to 3 months out in your initial enrollment period and not till July in the general enrollment period. Now it's always just the month after. If you wait past to the month of 65 or the past that date, it's always the month after you enroll. Now, as I mentioned, the base premium is $164.90 a month for Medicare Part B. There are individuals who do have to pay more than that. When we're taking your Medicare claim or your retirement claim, we don't know for sure if you're going to fall into that category most times, because it's going to go off your modified adjusted gross income. So we might be able to tell, if you have a significant wage income, but otherwise that modified adjusted gross income includes all sorts of other things. So what'll happen is after you've been set up, within a month or so, you'll get a letter letting you know if the situation does apply to you. Now, we're looking at 2 years prior tax forms. So this year in 2023, we're using 2021's tax year. If you have this situation, you're going to get a long, detailed letter explaining that you do have to pay an additional amount for your Part B and Part D premium. It'll also talk about some situations where we can use a different tax year if you've had a life-changing event. So one of those life-changing events is work stoppage. Well, when someone's retiring, that's a pretty common one. So we might be able to reduce or eliminate that income-related monthly adjustment. We call it IRMA for short. But there's other situations where you're just going to have a higher premium, maybe every year because you have a consistently higher income, or maybe just for 1 year because you did something like sell a house or something like that, which caused you to have a bump in your modified adjusted gross income in one tax year. So 2 years from that is when you would have that additional amount that you pay. Now, for Medicare, you can do Medicare only online in addition to all retirement and disability, things like that. You can also do your special enrollment period online now. So let's say you're already in the Part A, but you refused the Part B because you didn't need it yet because you had that employer group health. Once you are ready to get in the Part B, we're going to need 2 forms. The 40B, which you fill out and you put in the remarks, I want my Medicare Part B to start this month of this year. And then that L564, that's going to be completed by you or your spouse's employer, verifying you've had the coverage for every single month since you turned 65. And then that can be submitted online or faxed, mailed, or dropped off at your local office. Here's the Medicare.gov website. So this is where you can go on, review coverage, see what things are covered. You can create a personalized account so you can get your billing information. You can enroll in Medicare Advantage and prescription drug plans. You can figure out which ones are best for you. All those tools are available on their website. And as I mentioned, one of the things we refer people to is a SHIP counselor. So this would be, and I think Elgin has like a senior associates, I believe, and those have SHIP counselors. But SHIP counselors are free personalized counseling. They're trained to help you wade through the prescription drugs, the billing, the Medicare Advantage plans, all that sort of thing. And the nice thing about SHIP counselors is that they are not selling you a particular plan. So they're not working for Humana or Blue Cross Blue Shield or any one of those many, many different prescription or Medicare Advantage plans. They're just walking through the tools with you, helping you find which plans are best for you. And then you can pick, once they've gone through that information with you. So the easiest way to file for retirement, spouses, disability, or Medicare only, as I mentioned, is online through SSA.gov. And like I said, if you're at least 62, you can also file for retirement and disability at the same time. You might be wondering why you might want to do that. Well, disability applications right now are taking at least 6 to 8 months or more for a medical decision. So if you need some income right away while you're waiting on the disability decision, then you can go ahead and take that retirement right away while waiting on the disability. The only thing that's not available that we talked about today is survivor's benefits. So if you're needing to file for survivor's benefits, you need to schedule an appointment. Generally, the majority of our appointments are being done over the phone, but you can call and set up an appointment for your local office to talk to you through a phone appointment. In very limited situations, we are doing in-office appointments for those who are not able to use the phone due to barrier of some kind. We are also open to walk-in traffic for general questions or things like that. But you almost never need to visit a Social Security office because so much can be either done online or by the phone. Recently, in the last few months, we kind of revamped our socialsecurity.gov website. So if you've been on it a long time ago, you might notice that it looks differently. So the key is making sure that it's the .gov, that's to say .gov. And that's the same as you would want to make sure for Medicare or IRS or the Federal Trade Commission, all those. That .gov is important in making sure you're on the right site. So we have a lot of great tools and information through the website. So I encourage you to check it out if you've not before. You can prepare for eligibility. You can replace Social Security cards online, and you can do your applications for benefits as well. Part of our planning services are a variety of calculators. So we have a great retirement estimator, which is behind the My Social Security firewall, which we're going to talk about. But remember, I kind of talked about people who do not pay into Social Security, like teachers or certain city of Chicago, certain other categories. Now, a lot of times those people might have got their 40 credits, but they have their non-covered pension too. So that we have a calculator for, that's called our web calculator. Government Pension Offset, or GPO, also has a calculator and information. That earnings test we talked about, there's a calculator for that. So a lot of great resources there. And if you have not created your My Social Security account, that is your homework assignment. We recommend that everyone over the age of 18 creates a My Social Security account. There's a lot of great benefits to these accounts. So once, if you've not created an account yet, you go in and you sign in and create an account, and it's going to take you through login.gov to create one and back to our website. Or if you have an ID.me account, you can actually just log in with your ID.me information. You don't even have to do a separate account. If you already had an account and you've had one for a long time, like myself, I've had one for several years. Back before, I think it was September of 2021, when we changed things, you had a username and password that's a little bit different than how we do things. So if that's your account, you just put in your username and password that you always had. And then once you've completed, if you are going through the new process through login.gov, you're going to go through login.gov, be directed back to us, and then get an activation code to complete the registration process. So reasons why you want that My Social Security account. If you're on benefits, lots of things you can do. If you're on disability, you can report work. If you need it, maybe you're not on benefits yet, but you help someone that is. You might have heard them say, I need an award letter, I need my proof of income. We call that a benefit verification letter. You can print that right online. Of course, we're coming up on the end of tax season deadlines. Maybe you can't find your 1099. You could just log in and replace your 1099 right there. It prints it right for you from your My Social Security account. Change your address, bank account information, all those sorts of things. Great features there. But even if you are not on benefits, the reason we want you to start this so early at 8 to 18 is that is how you review your earnings record every year. So we used to mail those statements out every single year that I talked about toward the beginning. Now we will only mail them out when you are 60 or older and do not have an online account. Well, you need to really log in and check your earnings once a year. You don't want to find out when you're 60 that we're missing earnings that we earned, 15, 20 years ago, and you're trying to come up with proof of those. As long as you just check in once a year, check to make sure your earnings get posted correctly. And then you can use all the planning tools, like you can get your benefit estimate for not only yourself, but benefit estimates of what your spouses could receive, survivors if something should happen to you, all those sorts of things. And that's all inside that My Social Security account. So we used to send these out in the mail, and they used to be white with green ink. Now these are how they would look in your account. So They also kind of summarize your earnings early on in these statements, whereas in your actual screen on your online account, it'll break it down year by year. But there are some nice features on the statement. So if you're really fond of the paper statement, you can log into your account, you can print it off, or you can save it if you're on a personal computer to your computer. We also have added fact sheets that'll be dependent on your situation. So this is an example of a fact sheet for workers 49 to 60. If that's your age range, it'll be included in your My Social Security account. We also have them about Medicare when you're close, or those non-covered pensions. You can help someone in creating their My Social Security account as long as they're with you, they have their own email address, or you can help them create one, and they can answer the questions about themselves. So maybe you have someone that, like a friend or relative, they're just not very tech savvy. You can help them as long as they're sitting there with you, answering everything and having permission, giving permission for you to help them. But you cannot create someone, if they're not with you, you have a business relationship, if you're a representative payee of them or appointed representative. You can also visit a Social Security office to get help with the registration process if you bring in a driver's license, passport, or military or government ID. And then finally, what we always want to warn of is our scams. They are getting increasingly creative with these phone scams. People are continuing to fall victim to them, and they're just getting very good at being persuasive, threatening, all sorts of things. People are still losing a lot of money to these. So we just want to make sure that everyone is spreading awareness that Social Security will never threaten you, say we're going to suspend a Social Security number. That does not exist. We're never going to demand immediate payment, especially by cash, gift card, prepaid debit card, wire transfers, things like that. We always want people to just hang up on these calls, to not give any personal information. You can always call your local office after hanging up if you're concerned if it was legitimate or not. And if you have time, report the scam on our oig.ssa.gov page. We're also on social media, so you can keep up with us that way on any updates, office closings for federal holidays, things like that on Facebook, Twitter, Instagram, LinkedIn, and YouTube. And then we can go through any questions you have.